Now, this week, the Ghana Health Service will restart the immunization of children against the polio virus in eight regions affected or at high risk of being affected by the outbreak of the virus in Ghana and other West African countries. Despite earlier efforts at halting the spread of new cases, additional cases have unfortunately been detected in other regions and the Greater Accra region, bringing the total number of polio virus type 2 cases since July 2019 to 31, I beg your pardon. Currently, 11 out of the 16 regions in the country have confirmed at least a case and/or reported an environmental event of type 2 polio outbreak. So, what's the plan to tackle this comprehensively? I'm joined in the studio by Dr. Kwame Amponsa Achiano, is a program manager for expanded program on immunization. He'll first tell us about Ghana's situation as of now. Doc, thank you very much for coming.
Thank you too. Good afternoon to you.
Right. I mean, I wouldn't have expected to hear in the 21st century that we're still dealing with polio, because I think we stopped having all the big conversations about it. It wasn't as we used to. What is the situation right now? Because it looks like just when we thought we had made a lot of progress, we're having to revisit the conversation and even a nationwide immunization.
Yes, we have made a lot of strides, but polio is not gone yet.
I know. Yeah.
Yeah, so last year, somewhere July, August, we had the type 2 outbreak, as you did in your intro.
Yeah.
So we started the outbreak response. Normally, when you have just a case, you need to respond to it. So we started from the north, and we did quite a number of regions, but we kept on getting additional cases.
Wow.
And so we're responding when the COVID came in, and we had to suspend.
Do you think this has anything to do with the COVID outbreak?
You know, we started having the type 2 outbreak
way before,
in July.
Way before.
Remember, COVID came around December.
According to, but in Ghana, we announced our first case in March.
Yeah,
but then, when you say type 2, help us break it down for our viewers and myself.
Okay, so we have 3 different viruses that will cause polio. In fact, they are cousins, actually. You have types 1, 2, and 3. So the outbreak we had is a type 2 outbreak.
Yeah, go ahead.
Yeah, so, and we have basically 2 forms. You have what we call the wild virus, which recently Africa announced that we have, I wouldn't say eradicated, but rather we are free. Okay. Because once you have a case anywhere, you cannot talk about eradication.
Okay.
Yeah, so, but we had a type 2 outbreak last year, and we've been battling with it. Okay.
Is there a cause? Is there something that causes it that perhaps we can do something against?
Yes, in our case, it is because of very low coverage of immunization, not in Ghana, but outside Ghana.
Okay.
And once you have that, and you also have poor sanitation, there is a recipe for polio. And so we had an imported one, because our children were not protected against the type 2 virus.
I see.
At the time. But now we've done, if you remember, we did what we call the inactivated polio virus campaign to protect them. But of course, once you have an outbreak, you need to keep on responding until you break transmission. So that's what we are doing now. So
let's look at what you're doing right now. You're doing a nationwide immunization.
No, we are doing it in 8 regions.
Yeah, you could say it's
sub-national.
Sub-national. Yes. That's how you describe it. Okay, that's the appropriate way of description. But it still looks like 8 regions. It's still
8
a lot.
out of 16.
Yes.
In fact, we've covered the others in a phased manner.
Okay.
So these are the last 8.
So what exactly do you do? Your people go on the ground, like we know, with the immunization bags, and they come with, let's say, some kind of certificate, and they say we have to immunize your child.
Exactly.
How is it going?
So far, we are doing what we call the social mobilization. We are yet to start the actual vaccination exercise on Thursday, from Thursday to Sunday.
Okay.
So what we are doing now, for which we are having this
conversation,
is that we are trying to mobilize the society to support the exercise, also getting people informed well informed.
Do I get the sense that it has been a big, getting people to understand and come on board with this process has been a big deal for you, has been a big problem?
Well, for every campaign is different. So you need to approach it differently.
Okay.
And that is why we do social mobilization all the time for every campaign. I would say that immunization or vaccination is largely accepted, but you have very few areas, pockets of, I wouldn't say refusal, but hesitancy.
Why are they hesitant?
Well, if they don't understand exactly why you are doing, yes.
Which areas are these where you have the most problems?
I wouldn't say we have a lot of problems, but basically the gated compounds.
Okay.
The gated communities, you know, because of security,
areas.
Exactly, security reasons.
So somewhere like
they don't even allow
if it's in Accra,
is it a Bellagio
Airport residential area?
I know my really. Those who that have gates.
Ah, right.
So like the airport.
But shouldn't they rather be people who understand that this is a health emergency and rather respond to
That's why I'm saying that they probably do not understand what we are doing.
Or is it that they don't trust the system?
Oh, I think trust is relative, but largely, once you get people going to the immunization centers, then obviously they trust the system.
I see. Let's end this conversation by, telling our viewers why this process is very important and why those who are watching should be able to carry on the message to other people. As far as we know, it's about the future of our children.
Yes, the children are the most important resource of every nation. Polio, as you know, is one of the diseases that is earmarked for eradication. Eradication means wiping it out of the surface of the earth, except in some laboratories where research is done, so that it is no longer a disease that people would worry about. In fact, we've made a lot of progress. I'll say that we are now free of the wild polio virus in Africa and many other parts, except for 2 countries that are still endemic, Afghanistan and Pakistan. And we know that one polio case anywhere is a polio case everywhere. Okay. And therefore, protecting the children is very, very important. And that is why we are doing this exercise. More so when we have an outbreak. Yeah. You need to break transmission so that the children don't get paralyzed. Polio also kills. And so we want to protect our children. They need the vaccines much as they need their legs and limbs, other limbs. I think that
a very strong point he makes there is that you need it so that your children don't get paralyzed. And as long as there is one case is detected, we have to break the transmission. So what you have to do is to open up your doors and allow them. By the way, because of security reasons, people should look out for some kind of certification.
Exactly. We normally give them some kind of identification. And especially with the bag. It's the bag, nobody will go and buy those. The one you could.
People can steal it.
Oh, vaccination.
Just because they want access to your home.
Well,
thieves are very sophisticated.
I understand, but we also give them some form of aprons and in terms.
So when people come to your home, you should ask for the identification.
Exactly.
Okay. So what you do is ask for the identification. Make sure it's authenticated, and then you can open up your doors for them. But let's break the transmission and let's keep our children safe and away from paralysis. I've been talking to Dr. Kwame Amponsa Achiano. He's the program manager for expanded program on immunization with the Ghana Health Service. Thank you very much for coming.
Thank you for having me.